In this video clip, I will be discussing the joints of the thoracic wall. Before we begin, be sure you have a good understanding of the thoracic vertebrae and also the sternum. The majority of the thoracic cage is made up by our ribs, and we have 12 ribs on either side of our sternum. So I've highlighted 12 ribs here on the right. We have 12 ribs here on the left as well. Our ribs are considered to be flat bones, and they articulate anteriorly with our sternum. Here we can see the sternum, this thin flat bone, anteriorly. And posteriorly, our ribs articulate with the thoracic vertebrae. We've discussed the basics of the components of the thoracic vertebrae and also the sternum in a separate tutorial. In this specific tutorial, I want to focus in on the joints of the thoracic wall. And to do that, or before we do that, what we need to do is discuss the basics of a rib. Here we can see one rib highlighted here. I'm going to take off all of the other ribs so that we can discuss the basics of a typical rib, and then we'll be able to discuss some of the joints in more detail. I've now removed all of the other ribs, and we're just looking at one typical rib. Ribs 3 to 9 on either side of the sternum are considered to be typical ribs, meaning that they have very similar characteristics. Here's the anterior view of the typical rib, and all of these ribs are considered to be flat bones. We can see that it is relatively quite flat, although it does have a big curve within it. If I just rotate it to a posterior view here, we'll get a better look at some of the structures we're going to identify, or bony markings that we're going to identify. Now we're looking at a posterior view. We can see here's the costal cartilage anteriorly. So this is the posterior view of the rib. I'm just going to move it a little bit more so we can differentiate parts of it. There we go. Each typical rib, ribs 3 to 9, has a head posteriorly, and the head of each typical rib has two articular facets. Here's the inferior articular facet, and this would be the superior articular facet. And each of these facets will articulate with the thoracic bodies of the vertebrae, and we'll look at these joints in more detail once we've discussed the other components of the ribs. Next, we have the neck of the rib. Similar to many other bones, distal to the head is the neck. And then we have the tubercle of the rib. And on this particular animation, the tubercle isn't that large, but many of them, it's quite a big prominence, which we can easily see on the ribs. So this is called the tubercle of the rib. And then we have the shaft of the rib. So here we have the shaft of the rib, which goes all the way around, or the body of the rib. And where the body of the rib actually turns anteriorly, this is what we call the angle of the rib. So this here would be the angle of the rib. What we can see from a little bit better from an anterior view is on the internal surface of the ribs we have a groove. What we can see here is now the costal groove, which I'll outline. The costal groove is parallel to the inferior surface of the rib, and what we find within the costal groove are blood vessels and also nerves. And therefore the ribs serve as a protective function for these particular structures. The last part of a typical rib I'll identify from an anterior view, and this particular structure is just called the sternal end of the rib. So here we have the sternal end of the rib, and the sternal end of the rib articulates with the costal cartilage. This here is the costal cartilage. What I've done here is added on the majority of the bones of the thorax, with the exception of some of the ribs, and I've just removed some of them so that we can easily take a closer look at some of the joints that the ribs, or typical ribs, are involved in. Here we have the typical rib, number 6, that we were previously discussing, and we can see here the head of the actual rib is articulating with the intervertebral disc here, and also 2 thoracic vertebrae. I'm just going to zoom in a little bit so we can get a better look. The joint that we're going to focus in on is called the joint of the head of the rib. And the structures that actually articulate to form this particular joint is the head of the rib, articulating with the thoracic vertebrae, and also an intervertebral disc. Here we have the superior articular facet, and down here is the inferior articular facet, or would be here. And the superior one articulates with the inferior costal facet on the vertebrae above it, and the inferior articular facet articulates with the superior costal facet that has the same specific number as the rib. What this means is that if this is rib number 6, I'll just turn it again here, we can see that rib number 6 articulates here with T5, and also T6. So this is rib number 6. The superior articular facet articulates with the inferior costal facet of T5 here, and it articulates with the superior costal facet of T6 below. Surrounding this particular joint are ligaments. It's a typical synovial joint, so we have ligaments surrounding it. And although a lot of movement doesn't actually occur at this joint, small movements at the joint of the head of the rib can cause quite large movements at the sternal end of the rib. The next joint that we're going to talk about is called the costotransverse joint. The bones that articulate to form this joint is the tubercle of the rib and also the costal facet on the transverse process of the thoracic vertebrae. Here we have rib number 8, and the tubercle of rib number 8 is articulating with the transverse process of T8. These particular joints are also synovial joints and allow for a little bit of gliding. The upper joints within the thoracic cage allow for elevation and depression of the sternum. So here would be elevation and here would be depression. The lower costotransverse joints also allow for elevation and depression, but this movement occurs instead of in the sagittal plane within the transverse plane. The next set of joints that we'll discuss are called the costosternal joints, which we find between the costals and also the sternum. The first costosternal joint is different from the rest, and we'll discuss this one first. The articulation between the first costal cartilage and the manubrium is considered to be a primary cartilaginous joint. There is a thin layer of fibrocartilage at the end of the costal cartilage that articulates directly with the manubrium of the sternum. The remaining sternocostal joints are considered synovial joints. Although these joints are synovial joints, the actual articular cavities within the synovial joint is often absent, and fibrocartilage rather covers both the articular surfaces. The last joints that we'll discuss are between bones within the sternum, and here we have the manubrosternal joint. This is considered to be a secondary cartilaginous joint, and in most older individuals these bones are fused together. The manubrium and the body of the sternum aren't lying in the same plane, and where they actually meet we refer to this as the sternal angle because of the plane change. The last joint here is called the xiphisternal joint, and it's between the distal end of the body of the sternum and also the xiphoid process.